Markus. What about psychological factor of infertility?
Good question. I believe, I'm doing this for many years, and I have seen many couples, infertile couples, and I have not seen one single couple who had not a big amount of stress. And I have come to believe that stress is the single most important factor for infertility. Of course, there are cases with no sperm or no eggs, or very severe blockages for endometriosis or infections, of course. But in most of the cases, you don't find the single factor. You have a little bit of reduced reserve, but regular cycle. You have reduced sperm, or you have one tube which is blocked, but the other is open, and you don't really understand why these people don't get pregnant, because there are a lot of people who have the same problems, also a blocked tube or whatever, and they get many children without any problem. So you try to think, where is the factor which is the main reason why these people don't get their pregnancy. And then you see their stress level. They are so insecure, they have so many questions. If you talk to infertility patients, the consultation takes hours, and then they call you on the phone and have questions and want to understand anything. They use a lot of their time to investigate in internet. They want to understand what the problem is, and then they go always deeper and deeper and deeper in their stress. On the other hand, then the very infertility becomes a stress factor, because they have pressure from their friends who get pregnant, from their parents, from the whole family. And then this is like a vicious circle, like a spiral. And at the end, after a couple of years, these people have so much pressure and so much stress that only the infertility alone is the main cause of the infertility. And what you have to do at one point is to break this circle. So I was looking for techniques or for possibilities how to solve this. The most logic thing is to offer these people psychological help. But this is exactly what they don't want, because they don't believe or they don't feel that they have a problem. Because the psychologists are for crazy people or for people, but they don't have that problem, of course. So what you have to do is to explain them that, number one, the main cause for infertility is stress. Mm-hmm. And you ask them, do you have stress? And they cannot deny it. They say, yes, we have stress. A lot of stress. So what can we do to reduce this stress? And then we can start to offer them certain techniques. They can do meditation, they can do yoga, they can just go and have vacations, just go and have holidays and forget about infertility. Many people just get pregnant in holidays.
Yes.
Or when they have 10 IVF cycles after them and they say, okay, now stop, we cannot do it.
Yes.
They forget about pregnancy because in their head it's over, no more chance. After 10 IVF treatments, what do you think?
Yes.
Suddenly they have a spontaneous pregnancy because the head is free, no more stress. So I have come to believe that one very important factor in this whole infertility treatment is the stress management.
Yes. 90% of reasons of infertility is
stress.
stress.
This is only my guess. Okay, there's no literature. Maybe there is literature, but I'm not aware. But think yourself, in your consultations, 1 out of 10 patients have a real severe factor, right? No eggs, no sperm, very severe. But 9 of these 10 can get pregnant. Why don't they get pregnant? Then you blame, oh, there's a sperm problem, or here or there. But this is not the real reason. These people can perfectly get pregnant. And I have seen cases with impossible pregnancies. People with FSH levels of 80. You give them a little bit of estradiol, make them ovulate 1 single time and boom, pregnancy. I have seen patients where the male partner has 2 mobile sperm in the and they get pregnant from their partner naturally.
Yes.
So you cannot tell me that it's impossible. Why do people who have much better chances to get pregnant don't get pregnant? So after a lot of years of practice and of experience, this is my conclusion.
Mm-hmm. Yes. We agree with your conclusion. Yes. Thank you.
In Europe, which kind of analysis usually patients have to pass through before start IVF?
Okay. Now, if you use in your clinic the conventional IVF, then you are using an expensive technique, very invasive technique, which is dangerous, which has a lot of side effects. Technique. Did I mention expensive?
Yes.
Then technique which takes a lot of time and energy for the people. So you are using something which is severe and heavy for the patients. And in order to avoid that, you try to find a reason, an easy reason to overcome. Because in some cases, you are able to do only insemination, or to start with insemination. So the main focus of the initial examination is, can I do first inseminations, or do I have to go for IVF immediately? So you need a lot of exams, like look at the tubes, look at the hormone levels, do a battery of tests to make this decision. Can I start with insemination, or do I have to do the big treatment as a first-line treatment? Now, if you're using natural cycle IVF or mild stimulation, in this case, the treatment is not so heavy. It is more comparable with the insemination than with the heavy IVF, but you have the efficiency of the IVF. So you can reduce the initial exams to a complete minimum. All you have to make sure is, if the woman is able to carry the child, if the health permits to do this, and if there are eggs, if there are sperm, and if there is some severe pathology that you have to operate first before you can do the actual treatment. So all you have to do is a short anamnesis. You have to look if there is sperm. You have to do an ultrasound in the woman, and that's all. If you talk about infectious diseases, the minimum and the most important 4 are HIV, hepatitis B, hepatitis C, and syphilis. Because these 4 infectious diseases are very contagious, and they are very dangerous for the patient and for the pregnancy, and of course for the baby. And especially if one of the partner is infected and the other not. You don't want an infection to the other partner. So these 4 infectious diseases, or the test of them, has an impact of your treatment. In these cases you have to do a special treatment, And of course, you also don't want to infect the lab personnel, the staff in the lab or the doctors. So you have to test these 4. But other infectious diseases are not really directly relevant to the treatment. They are more relevant to the pregnancy later. So once the pregnancy is there, then you should look for rubella or toxoplasmosis because then it has a relevance, but not for the actual IVF treatment. So you, in my opinion, you can reduce the tests to these 4.
Last question about our project with Perspective Group, light stimulation.
So I have established in the last year in Nepal a treatment or a treatment program which is based on mild stimulation. We are able to offer the same results as for conventional IVF for maybe 10% of the price. Maybe no, let's say 1/4 of the price of the costs of the regular IVF. This treatment consists of minimal stimulation, which uses or no injections at all, or if you have to use injections, then it's very light, very low dose. The objective is to get 3 eggs out of the stimulation. Then the egg retrieval is done without anesthesia. It's done in 2 minutes, the whole procedure. It doesn't hurt. The patient can get up and go home or go for work instead of being hospitalized, having to stay at home the whole day because of the side effects of the anesthesia. Then the lab procedure is much easier because we only have to deal with 1 or 2 eggs instead of 10. We don't need so much culture. We don't need so skilled embryologists. We can transfer all we have because we only have 1 or 2 eggs and then embryos. And then, because of the light stimulation, you don't need so much medication after the treatment. So everything is much gentler, much more, much cheaper, and much more natural. And especially much more patient-friendly. And the whole treatment reduces the stress because the patient doesn't always have in mind, oh my God, if this goes wrong, I have paid so much money, I have gone through so many injections, now I need this pregnancy. No, the patients are much relaxed because they say, oh, if it doesn't work, it was really nothing. I had 2 controls, I had to take some pills. What is it? If I don't get pregnant, there's a next month I can try again. It's really not so much stress. I have to give you one example.